Hey folks, Cherry here from Sedana Surgical Services, and I am coming back with another controversial hot button topic that I want to talk about today. You ready? Let's get into it. What am I doing, right? What am I doing? I want to talk to you about lipo before a tummy tuck. Is it a good idea? Is it not a good idea? Why you should avoid it? Why you should not do it? Let's talk about it. So, if you are one of my patients, have been one of my patients, or are looking to be one of my patients, this is how things go when you work with me, okay? So the surgeons that I work with are definitely like dedicated to making sure that you get the best results in the least amount of procedures possible without spending the most money. I mean, we're really concerned about you as a whole, right? And that's because I'm here watching, and I'm not going to let anybody charge you once, 2 or 3 times for something you can have done the first time. Okay, that's the first thing. So getting back to talking about lipo before tummy tuck, right? One of the things that I want you to understand is if you're going to submit a quote to be one of my patients or to work with one of my surgeons, please understand that you're going to have to go through some type of virtual evaluation. As you undergo this virtual evaluation, what's going to happen is we're going to look at your photos and we're going to be paying attention to different areas of your body. So let me show you, because this is the easiest thing, right? So we're going to be looking at your front, your sides, and your back, right? Now, it's important for you to submit these photos in a manner where we are able to see more than this. Because if I send you a picture like this, you don't know if I need a tummy tuck or if you need lipo or if I need anything, right? You have no idea if I need JPlasma, you don't know anything. Now, if you have something like this, you see that I don't need it. I could use a mini tummy tuck, but that's something that you won't tell in pictures. However, if you have something hanging over your underwear or anything like that, you need to understand that your skin more than likely will not be in a position to retract to the level that you're going to want it to in order to achieve the result that you're going to want to achieve, okay? So understand that. So if for some reason you submit a quote request with me or for one of my surgeons and I go ahead and evaluate you and I come back with, hey, you need a tummy tuck, this is why. So I want to talk today about the fact that I know a tummy tuck is not most girls' first go-to, right? Most of us want to avoid an incision. Most of us want to avoid scarring. And most of us have this idea that the tummy tuck is like the most painful thing ever. When you have to realize that, first of all, I need to like squash the myth real quick. The worst part of this surgery is going to be your lipo. So whether you want to get a tummy tuck or not, please understand that the majority of the pain is going to come from the lipo and not from the tummy tuck. That's the first thing. The second thing is, a lot of times when we have either had pregnancies or have gained weight, have gone up and down with our weight, right? Our skin has gone through a lot. If you consider, I've been alive 37 years. My skin has been through everything with me. I mean, if you look at my incisions on my stomach, you'll see that I have more than just plastic surgery incisions. I have incisions from my hysterectomy. I have incisions from exploratory surgery. I have incisions from all kinds of things, right? And so my skin tells a story, and it's been through a lot. And so a lot of times we come for plastic surgery to correct those issues. However, not every procedure is going to fix what we're looking to fix. Okay, so sometimes when you've had pregnancies, when you've had weight gain and fluctuating weight in general, where your skin has stretched and come back and stretched and come back, after a while, like anything else, right, your skin loses that elasticity. And so lipo and vaser and all those things are definitely options for you to remove the fat and to take the fat out. However, they are not sure fixes for your skin. And this is something that you have to understand. The skin that you have right now only looks good, even right now, even the way I'm sitting, it only looks good because it has fat behind it. So what most people don't realize is that the only reason our skin looks this way and doesn't look like this or doesn't look funny is because that fat that's behind it is supporting it, is giving it that pressure so that the skin doesn't look wrinkled, it doesn't look stretched, it looks tight. However, when you go ahead and remove that support from behind it, this tends to crumble. And if it's not at a light area where the vaser can trigger that skin to retract, what's going to end up happening is you're going to have loose skin. there's not going to be enough abdominal boards, compressions, fajas, massages, machines, cavitation, ultrasound that's going to shrink your skin back to the level where it's going to give you the aesthetic result that you tried to pay for. It's just not. So I don't care what anybody tells you. I don't care what people say. I don't care. At the end of the day, I'm telling you the truth. Another thing, JPlasma. Let's talk about JPlasma and the marketing scandal behind JPlasma. Okay, so JPlasma is it's an intervention that is offered for people that have loose skin, right? So this is something that I got going on, right? I have some loose skin. If you notice, I'm sitting. I'm not fat. This is literally, it's just skin. See that? This is a reason to have a tummy tuck. If you look like this before surgery and then they go to take the fat out, this skin is not going to snap back. And so this is where I want to go with you. Talking about JPlasma, talking about the tummy tuck, talking about mini tummy tucks, talking about me, and talking about what can happen. Okay? So just follow me. JPlasma. People market JPlasma like crazy. First of all, you got to understand, JPlasma is very expensive. JPlasma can cost you about $800 a vial. When I tell you a vial, I mean a vial. A vial is about this big, okay? $800 a vial. Now, if I, little old me, wanted to do something to my arm, don't you think I'd need more than one vial? Especially if I want to do both my arms. So it gets costly, right? These doctors will sell you JPlasma, will tell you that it's going to tighten your skin. It's going to do this. It's going to do... Let me tell you something. We don't sell JPlasma. We can offer it. I have sat in over 100 consultations easily where we have patients that will ask us in the moment, well, do we have to do a tummy tuck? Do we have to cut? Can't we just do some JPlasma? We can sell you JPlasma all day, every day. What's going to happen at the end of the 6 months, the end of the year, a year and a half, when you're finally really settled into your healing and everything else and your skin looks like crap? You're going to say that I referred you somewhere where they stole $1,000, $2,000, $3,000 worth of your money in JPlasma and something that doesn't work. And guess what now? You need a tummy tuck. Tell you from experience. So let's talk about me. Because sometimes people think that this is just something that happens to big girls. This is something that just happens to girls that have gained a lot of weight or have lost a lot of weight. And you have to understand that that is not always the case. Back to me. I am 5'4". Right now, I am about 130 pounds. When I came for my surgery originally, I was literally about 125 pounds, right? When I had my first surgery. Or when I had my Lipo BBL. Now, I want you to see something. When I came for my Lipo BBL, I looked like this. So I was a little bit fatter, a little heavier here. And I kind of said, do you think I'm going to need a tummy tuck? Do you think I'm going to need a mini? Am I going to stay loose? I really don't want to stay loose. My stomach has always been really nice. It's always been one of the highlights because I don't have much legs. I'm very small. So are we going to jack up my stomach? And the answer was no, you're great, blah, 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 whatever. Well, honey, after they did lipo on me, this is what happened to my skin. I stayed with old lady skin. And this is not me doing anything aggressive at all. And so now one of the things that bothers me is, as you can see, when I sit down, I have this bunching of skin that looks like I am an old person. And I didn't have that before. Now, that's just an example to show you that it's not just larger sized girls that are impacted by this. Now, how do I fix this, right? Because it's clear that I don't even have enough skin to give me a full tummy tuck, because I don't. I've never been more than 135 pounds. And my skin is not really stretched. And my skin is very, very tight because I use a lot of moisturizer and lotions and stuff. So what does that mean for me? That means that I need to have a mini tummy tuck. Now, I have multiple options. I could go the Vaser route, right, and do high definition Vaser lipo, which is a technique and a machine that is done a little bit differently than regular lipo, traditional lipo. Vaser lipo is a lipo that's done with an ultrasound technique. It pretty much melts the fat versus just sucking and ripping, which that heat and all of the process within Vaser allows your skin to have better retraction, and it allows it to stick a little bit better. Partially because your skin is just not going through as much trauma as with traditional Vaser, traditional lipo. But again, at the end of the day, that's still not going to give me the result that I'm looking for. It's not going to take care of it. The only way that I can fix that is to have a small incision done. And I'm going to show you because I know most women are concerned about this. So this is my pubic area here. I'll have an incision done probably from here to here, which will just pull this skin. See? We'll just pull this down and we'll tighten my skin. We'll take care of all of this. You understand? My belly button will be fixed or whatever, but it will take care of this because I don't really need a tummy tuck, a full tummy tuck. You understand? But I definitely want to get that fixed. It's something that bothers me, and so I wanted to talk about that because a lot of times girls have this idea that, oh, they want me to have a tummy tuck. They're trying to make me have a tummy tuck. It's not that. You have to understand that you're coming to a plastic surgeon. You're not coming to your homeboy or your homegirl, right? You're coming to a plastic surgeon who professionally makes their money, makes their living, builds their reputation off of delivering good results, delivering the best results aesthetically possible, right? And also safety. So you can't come here and think that we're trying to force you into a procedure to take your money or for anything else, because truthfully, we're trying to put you through a procedure that's going to allow you to not need to return. Because what happens when you go ahead and you get lipo done first, you end up like me, where you end up healed, you end up wearing your boards and your foams, and you try everything, and you go through massages, and you go through all types of extra treatment and skin tightening treatments and everything else like I have for over a year. And guess what? Nothing makes a difference. Nothing fixes it, because that skin has gone through cancer with me. That skin has gone through surgeries with me. That skin has gone through 2 pregnancies with me, full term. You understand? So that skin is already like, we're here, we're hanging out, but don't expect too much from us. And so you got to consider that your skin sometimes is saying the same thing. And it's not an insinuation of, oh, you're big or this or that. It's just that in order for us to give you the results that you're going to truly be happy with, the results that you're truly going to want, we have to do it sometimes. Please understand that a surgeon is not going to take, oh, well, you know, I'll do lipo now because that's what I want. And then, you know, I'll come back next year to do a tummy tuck. No plastic surgeon is going to put their reputation on the line for that. And so those are things that you have to understand. Dr. Sanchez, what do you think about JPlasma?
It's a good technology. Es una buena tecnología, pero debemos saber que está usado solamente en pacientes que tienen indicación para usarla.
So what he's saying is that it is a very good technique. However, we have to make sure that it is a technique that works for you. Because like I said to you earlier, if your skin is not in a position to retract using the JPlasma, you know what's going to happen? It's not going to work. And like I said, we're going to end up taking your money. You're going to be disappointed and discouraged, and you're not going to get the results you want. And that's definitely not something that we want. So with that being said, if you have any questions about a tummy tuck, about a mini tummy tuck, about compression, about how to get your skin to retract, about anything post-op, make sure you comment it down below, because we're always doing these videos to make sure that you are completely educated so that you are confident when you leave your house to go to any plastic surgery facility, including ours. So if you need anything, make sure that you contact me. I'm always here to help. And I look forward to seeing you at our next video. Don't forget to comment. Don't forget to subscribe. Hit the notification bell so that like that you can like stay up to date with us. And yeah, I'll see you in the next video.